I wake up in the morning and it's like, what's next?
Ronald Rawlings says each day at Twin Lakes Rehabilitation and Nursing brings an unexpected challenge. He describes his experience living at the South Hill Long-Term Care Facility as inconsistent ever since new ownership took over.
At least at first, it was consistent at first, and now it's like, I'm just at the point now, it's like, okay, it's time to go.
VCU Health's Community Memorial Hospital used to operate what was called the Hunley Center, but sold the facility to the New Jersey-based Eastern Healthcare Group on April 1st, according to VCU Health. With it came the name change to Twin Lakes and a shift in ownership type from nonprofit to for-profit. Rawlings, who's lived at the facility since 2023, says one of the biggest differences he's observed is a decrease in the number of employees, as he alleges in a complaint to the Virginia Department of Health.
The nurses that are charged with my care are doing a very good job. Now, those nurses are working to the max. They are short-staffed.
He claims in his complaint that has led to medications not arriving on time and showers not occurring as frequently. So before, when it was run by VCU, was it short-staffed like this?
No.
It wasn't?
No.
Rawlings says he has not yet received VDH's findings pertaining to his complaint, and Eastern has not returned a request from CBS 6 to respond to his allegations. However, the Centers for Medicare and Medicaid Services, which regulates nursing homes, confirms a considerable drop in staffing levels following the acquisition. That data shows that the facility went from a 5 out of 5 star, well above average staffing rating from January through March to a 2-star below average staffing rating from April through June. Now, during that time period, the CMS data shows that under VCU, there was nearly 1 whole extra hour of reported nurse staffing per resident per day on average. According to some more data collected just before the sale, CMS gave the Hunley Center a 5 out of 5 star overall quality rating, which indicates that it performed well during health inspections. Twin Lakes has not yet had an inspection, but Eastern Healthcare Group overall has a chain rating from CMS of 1.4 out of 5 stars as of July 2025. And that indicates that the group's 17 facilities perform poorly on average on health inspections and staffing measures. Only 22 of the country's 600-plus nursing home chains have a lower overall quality rating, according to CMS. Now, we've asked Eastern for a response to the company's ratings, but we have not yet heard back. Rawlings tells me he's also troubled by past findings against the leadership put in place at the facility after the ownership change, as both the administrator, Shondell Samuels, and director of nursing, Latarsha Brown, have been recently disciplined by the state.
I think that probably sparked a concern for everybody's safety.
According to licensing board reports, Samuels and Brown were formerly in those same roles at Henrico Health and Rehab at the time of a 2023 inspection. Henrico was identified by CMS back in January as Virginia's poorest performing nursing home based off the results of its last 3 years and cycles of inspections. So, citing the outcomes of that inspection, the Board of Long-Term Care Administrators in July 2025 placed Samuel's license on probation, in part because they found she failed to protect residents from multiple instances of abuse. And earlier this month, the Board of Nursing placed Brown's license on probation, in part finding that she engaged in abuse of residents and failed to properly address neglect. We were there during a public hearing in November when an attorney for the state made that case to the board.
She, at the very least, allowed negligence or abusive behavior to go on at this facility on her watch, potentially that she even participated in it.
Brown denied wrongdoing and argued that she was a new director of nursing at the time with limited knowledge, and she told the board that she and Samuels were given direction by their previous leadership that she believes they would not have followed themselves.
I have very much taken responsibility for the actions that I played. However, I do know that in certain situations, some of these allegations, I know I was lying, but I did not take part in them.
The board did not find her testimony to be credible, according to the case findings. Their probations mean that Samuels and Brown can continue practicing, but they're subject to additional training, reporting requirements, and state monitoring for at least 2 years. Board documents show that both women were terminated from the Henrico facility after that 2023 inspection. The Commonwealth began initiating proceedings against them in 2024. State records show the pair was working at Twin Lakes as of September 2025. We've asked Eastern if and when they were made aware of the licensing actions against Samuels and Brown, and if both are still employed at Twin Lakes, but they have not yet responded. I also reached out to Samuels and Brown directly regarding their cases, but they have not provided comment.
The state got to have some more oversight. They got to be held accountable. You got to hold them accountable.
Rawlings says while there are some bright spots at Twin Lakes, such as the dedication of the staff and the availability of activities for residents, he's worried about where the facility is headed under new owners.
Your way of business is failing. The things that's going on at Twin Lakes, like I said, hey, it just needs to get better.
I'm Tyler Layne for CBS 6 News.